Hi, it's Mary. I'm so glad you are here with me today, and I'm so excited because we are outside the Mayo Clinic in Rochester, Minnesota. People from all over Minnesota, the United States, and the world come to the Mayo Clinic for treatment for various conditions. The doctors and staff of the Mayo Clinic treat the whole patient, not just their condition. I visited the 9th floor of the Digestive building where they specialize in gastroenterology and hepatology. So I'm going to share information about one condition that they treat and some of the follow-up procedures that can be done for that condition. So this is a diagram of the digestive and excretory system. So when you eat food, you know that you swallow it at your mouth, it goes down your throat, through the esophagus, and into the stomach. In the stomach, it's digested, and then it goes further through the rest of the system. So it goes through the small intestine, where nutrients are reabsorbed, and then into the large intestine or the colon, where it goes around, and then the waste goes out of your body. I'm going to talk specifically about ulcerative colitis today. So the name of the disease generally tells you what it is. Ulcerative, there are ulcers, and they form in your colon, so colitis. And itis at the end of anything means there's inflammation. So there's ulcerative colitis, you have ulcers and inflammation in your colon. In addition to the ulcers and inflammation, people with ulcerative colitis can develop polyps. They have a lot of mucus. Sometimes they have diarrhea. This can also result in fevers and chills and weight loss. So medications have been developed over time to help control and lessen the symptoms of ulcerative colitis. Because of the ulcers and the polyps, doctors need to look at the colon periodically to make sure that it is healthy. So they often do a colonoscopy. And with a colonoscopy, they just take a scope and they look into the colon to make sure that it's healthy. As they do the colonoscopy, if they find any ulcers, they will take a biopsy and they'll take a sample, do a biopsy to make sure the tissues are healthy. They'll also remove any polyps and do biopsies on those. So if they find in the biopsies that there are any precancerous or cancerous conditions, then they have a couple things they can do. And sometimes that treatment will involve removing the colon. So doctors and surgeons have been removing colons from people for a long time. And in the past, what would happen is they would remove the colon and they would reroute your small intestine. So it would come out here, you would wear a bag, and then as the bag filled with waste material, you'd empty it, you'd clean the bag, you'd change it as needed. And they still do that operation, but now they are able to make an addition to that to help improve the quality of patients' lives. So what they can do now is when they go in to remove the colon, they can create a pouch in the ileum of your small intestine, and in that pouch, after a period of time, it will act as your new colon. So they put the bag on, but after a few months, they go back in, they look to make sure that your pouch will function properly, and then they'll do a second procedure where they reconnect you. And so in either situation, whether you have the outer bag or whether they create the pouch, patients' lives are improved and lengthened by these procedures. So I am not personally a patient at the Mayo Clinic, but I do have a very close personal friend who had the procedure done here. a few years ago, and the quality of his life and his ability to participate in activities that he normally participated in has been greatly improved, and this is all due to the care and the help of the doctors and staff at the Mayo Clinic. So if you have an interest in biology, if you like medical sciences, if you like helping people, pursuing a career where you are either a doctor or a surgeon or a researcher in medical sciences is a great field to pursue. I hope you enjoyed this brief introduction to research in medical sciences and our visit to the Mayo Clinic. Thank you.